Hey everyone, and welcome back to the channel. Today we're going to talk about a topic that affects millions of people worldwide, diabetes. You've probably heard of it, but did you know there are different types? Let's break down the two main ones, type 1 and type 2, and understand what makes them so different. It's really important information, so let's get right into it. First up, type 1 diabetes. Think of this as an autoimmune condition. For reasons that aren't fully understood, the body's own immune system gets confused and starts attacking the cells in the pancreas that produce insulin. These are called beta cells. When these cells are destroyed, the body can't make the insulin it needs to survive. This is why type 1 is often diagnosed in children, teenagers, and young adults, though it can technically appear at any age. The symptoms can show up pretty fast. We're talking about things like being super thirsty, needing to pee all the time, feeling incredibly hungry even after eating, unexplained weight loss, and blurry vision. People with type 1 diabetes need to take insulin every day for the rest of their lives. Now, let's switch gears and talk about type 2 diabetes. This one is much more common and is often linked to lifestyle factors, though genetics play a big role too. With type 2, the body either doesn't use insulin properly, this is called insulin resistance, or it just can't produce enough insulin to keep up. Unlike type 1, type 2 diabetes usually develops over many years and is most often diagnosed in adults. However, with rising rates of obesity, we're unfortunately seeing it more and more in younger people, including kids. The symptoms can be very gradual, sometimes so subtle that they go unnoticed for a long time. They can be similar to type 1, but might also include things like wounds that heal very slowly or getting infections more frequently. So, let's do a quick recap of the key differences. The cause. Type 1 is an autoimmune attack, while type 2 is about insulin resistance and lifestyle. Insulin dependency. Type 1 requires insulin from day 1, whereas type 2 can often be managed initially with diet, exercise, and oral medications, though some people might eventually need insulin. And the onset. Type 1 typically appears earlier in life, while type 2 is more common in adults. Understanding these distinctions is crucial for proper management and even prevention, especially for type 2. If you're experiencing any of these symptoms or have concerns, it's always best to talk to a healthcare professional. They can provide accurate diagnosis and guidance. If you found this video helpful, please give it a thumbs up, subscribe for more health content, and share it with someone who might need to see it. Thanks for watching, and see you in the next one.